behind schedule, but now.
I see.
Okay. So thank you so much, dear friends, for being in this English StreamYard for our first meetup. It's really, really great to be here and also to be able to have with us now Andy Bleaden, the Director of Alliances in ECHAlliance. Andy, maybe we'll start for you to introduce yourself a little bit while we're waiting for João to join us.
Yes, of course. Obrigado, Paul. And olá, colegas. That's the end of my Portuguese for today. You'll be very pleased to hear. I just introduce myself. My name's Andy Bleaden. I'm the Director for Ecosystems and a membership for the European Connected Health Alliance, also known as the ECHAlliance.
Fantastic. And anything else you'd like to add about your contributions to digital health in Europe? What is it that ECHAlliance does?
Okay. In a nutshell, what the European Connected Health Alliance do is connect up the dots in healthcare. So we have a network of what we class as ecosystems, this being one of them, across the globe, stretching all the way from Argentina up to Finland, down to Sri Lanka and over to Australia. As of yesterday, I've just opened up and agreed to open up our 61st ecosystem, which is fantastic because our ecosystem network is there to be able to enable ecosystems such as Digital Health Portugal to connect up with other ecosystems globally. That gives a unique opportunity to collaborate, connect, scale up, and I think create a great big global movement around health.
That's interesting, Andy. And it is really a pleasure to have you here with us and share a little bit the conclusions from our first meetup. Carina and Pedro were moderators of two very interesting sessions. I was doubtative at the beginning because there was a number of participants that, due to late registration, didn't join the Zoom room. But Carina, can you share a little bit what was the main takeaway from your session today?
Well, Paulo, thanks again for putting this together because it was very interesting. The session I shared was innovation in health. And in fact, it brought really nice examples of how Portuguese companies are progressing in bringing different and really innovative solutions. One of them was targeting heart genetics, which is targeting a solution to understand the genome. You can make a test, know how your genetics interacts with drugs, and then the doctor can provide you a medication that is suitable to you. So very interesting for several number of different areas of health. And the other one we were listening about is Neuros, as a way of training neurofeedback and improving your performance through brain training. And it's actually being used for sports and to enhance the productivity of football players, for example. So very different things. Then, of course, there were a lot of participants in the room and we ended up discussing sharing data and how to progress in the business models in health. So it was a very productive discussion and a good start to see that Portugal is filled with very nice and interesting products to upscale.
Fantastic. And how about you, Pedro? What can you share about your session also this afternoon? And then perhaps Andy can comment on these takeaways that you are sharing here.
Okay, so my session was about partnerships and ecosystems, so something that Andy knows very well how to do it. In fact, the four presentations all shared the same global ideas, and the ideas were if the companies and the responsibles of those companies really are committed to the wealth of the community, they can do amazing projects, and also that together the companies can be stronger. And that was a very important message. Even we had an entity like TIS. TIS in Portugal is the National Portuguese ICT Cluster. So yesterday we closed a partnership with them. So it was very important for us to have these in this session, because they represent all the ICT, all the, let's say, the biggest ICT companies here in Portugal. They have a lot of projects regarding digital health. So it was very, very important to know and to have some clues about how companies can work together in partnership, and how can they be part of a stronger ecosystem. Then we had also a presentation from the ECHAlliance, where they shared also some information and also some clues about the COVID-19 responses, and how companies together also, and not even technological companies, but from different industries, join forces to solve, let's see, this pandemic situation. So it was a very interesting session, because a lot of different perspectives with a common goal work together in partnership and belong to a really strong ecosystem.
Fantastic, fantastic. And now I'm just waiting that João Figueiredo is also joining us in this moment. So Andy, from the intervention so far, and in terms of what is your experience from other ecosystems in Europe, and not just in Europe, do you think that Portugal is now a country that is taking the lead in digital health?
What was really good to see this afternoon, in the sessions where I could understand and hear, or if they were written in English, I saw a couple of the examples, one of which Carina talked about. I was very, very impressed. What I have to say, and I say the same message to all our ecosystems, is don't undersell yourself, okay? Because there's plenty of other people who do that for you. You've got a great level of opportunity within your clusters, in your ecosystems, with your innovators, project partners from the projects I saw being presented earlier on, to showcase Portugal to a wider global network. One of the things I was impressed with was the couple of examples Carina talked about. Is that's exactly what people are looking for. These are exactly the type of solutions that people are seeking. Our role is nothing more than gluing together need on one side and solution on the other. In essence, that's what ecosystems should do. Our network of ecosystems is about showcasing that to a wider audience. So an offer I'd like to make, and this is hot off the press offer, is I'd like to, seeing as it's the presidency period for Portugal, to showcase Portugal's ecosystem in our ecosystem of the month feature we've just launched, and to put those innovators not in front of a Portuguese audience, not in front of a European audience, but a global audience. And I think that's a golden opportunity for both of our ecosystems we've got there that exist in Portugal to really have an opportunity to shine. And I think just a basic offer, which is show us your champions, show us those people that you would like to project outside of Portugal who get innovation. Because the more you do that, the more interest you'll get and the light will shine back into Portugal. The last thing on that is we're also, with our work with the Global Health Connector Partnership, bringing in partnerships from across the globe, from Latin America, and you saw the opportunity this afternoon from Brazil. We know about the opportunities and the links with India. That's only going to go stronger as our partnership grows, because this year our ambition is to work very closely with that Global Health Connector Partnership to identify and locate opportunities, not just within India, but within Africa too. And that's something we're really keen to do with yourselves, with our existing network of ecosystems and with our future network too. Because the last thing that we're looking to do as well is to set up a series of thematic ecosystems that are cross-border in nature, where you can work collaboratively with other ecosystems, other partners, other projects on thematic areas which are horizontal and not vertical. So there's two offers there. One of them is the showcase in Portugal within our ecosystem network.
Fantastic. I also believe it's true that I would say we have an expression in Portuguese. I'm sure Carina and Pedro will identify, which is the old man from the Restelo, the velho do Restelo. No, it's an expression in Portugal that Camões, our great poet, wrote about. Whenever a society is facing innovation, whenever a society is facing transformation, what happens is that there's all voices in the society that are always restraining and skeptics about this transformation and innovation. And when COVID pandemic fell on us, some voices said, "Oh no, we need to go back to nationalisms. You need to go back to protectionism." But now everybody understands that the way out of this pandemic, and especially with the supply of vaccines, is really to global commerce needs to work back again. Global commerce needs to be back in business so that we can have vaccinations for all, and then obviously for all mankind to benefit from these developments, right, Carina and Pedro? Because these innovative startups we've seen in Portugal, their target customers could be anywhere in this planet. Right, Carina and Pedro, any comments on this? The need for a global village to be reinstated after pandemic?
Well, I think you are absolutely right, of course, and I have been saying that the pandemic can either be an opportunity for us to regress or an opportunity for us to progress, and I do hope that we progress. And a part of the learning is exactly what you were saying, is that at a certain point, we need to understand that no nationalisms, no fascisms, no kind of closure will benefit us. At this point, society needs to be seen as a common good, as a common goal. We all need to take the most advantage to benefit all, because otherwise it will come back to us. So I do hope that this is a learning out of this. And of course, it's very focused on business as well, because this is the only way for products to be successful, is if they have the chance to go outside of the country and to be upscaled. And that's the good part of the ecosystems, the partnerships and the collaborations, is to be able to do these bridges. So I can only agree.
Fantastic. Pedro, how about you?
Yes, no, I also agree with Andy, and I have a strong belief in the new leadership of Portuguese startups, not only Portuguese, but in Europe and in the world, because I think it's not only the agile methodology, but also the agile mindset. Okay, and that is very important. Every Portuguese startup company in health or other industry doesn't think only in Portugal, or sometimes don't even think about Portugal as a market. Okay, they think globally. They are not committed to the past. One example, the use of European funds. We have today Portuguese leaders of big companies that say, I don't want to use it because I don't need that money. I prefer to use my own money. So that kind of mindset, I think, already changed in these new companies that are arriving to the market, in not only in health, but because in digital health, and I work with a lot of startups for several industries, what I see is a big focus, and even more focus than in other industries. And I think that the reason is these leaders of this new generation of leaders in startups of digital health, they are very positive and they think globally, and they are not afraid of belonging to ecosystems and share and have partnerships with the other companies and countries, and that for me is it's very important, and I think Portuguese have a good future in this digital health industry.
Absolutely. And my friends, since we are still waiting for João Figueiredo to join us, I think he confused a little bit the time slots. So that we were starting at 5:30 UTC. Let me just throw in here something that I saw recently in the news, and I am sure that you are going to be surprised as I am with this last news that I have received, that I have seen recently. Let me see if I can get you on the right page here. In the Market Insider, are you able to see my screen yet or not yet? Maybe not.
Yes.
You are able to see it? Okay. And this is from the Market Insider. It's like Sanofi, Capgemini, Generali, which is an insurance company, Orange. They have all combined forces in France to create a digital ecosystem where they are going to create living labs for thinking the healthcare solutions of the future. This is an investment of 24 million euros. And wow, this is going to be revolutionary, right? So when you see a pharma company, a consultancy company, an insurance company, and a telecom company combining together, what can we expect from these moves, Andy? Any comments on this perspective here?
One of the nice things that when I see that is obviously what's coming down the line in not 6 months but 12 months is a French presidency of the EU. Okay, and it's timely because there's been a lot of unhappiness in France with the work and the progression and innovation, and yet they still can't see the innovation that sits there in some of the innovation hubs up in the north of France, perhaps in the Breton region or in Normandy, that's really exciting and innovative. But it's good to see that we're starting to see those telecoms, the pharma industries, etc., looking to work together, because we know pharma industry are desperately looking for small digital solutions because they're too big to innovate themselves. And that's where the opportunity comes for startups and scale-ups, because they can't innovate. They're too big. Think of the Microsofts of this world. They're too big to innovate anymore. They use other people's innovation and use it well. That's a try business model. So it's very exciting.
That's exciting. And I'm sure that ECHAlliance is also a place where we can combine these big companies and the startups to build things together. Finally, João Figueiredo is here with us. João Figueiredo is the CIO of a major hospital from the social sector in Portugal, Hospital da Perlada. João kindly accepted to be a moderator on one of the streams this afternoon in the first meetup of Digital Health Portugal. He's also a renowned CIO, a real stakeholder in digital health in Portugal. And João brings the perspective from the hospital, the healthcare service provider organization. João, are the healthcare organizations in Portugal ready for this transformation? And tell me a little bit more about the conclusions from your discussions.
Thank you very much. Hello from Portugal, especially from Porto. I'm speaking from Gondomar. As you know, Gondomar is Monaco from Portugal. So I hope you enjoy this meeting. Thank you to the organization. First of all, we all speak about the patient of one, the priming from the healthcare to the next normal. But in fact, in our meeting, we ask ourselves, where are our organizations focusing? So it's about innovation, acceleration, stabilization, and early response. Those 4 topics were the first that dealing with the uncertainty forces healthcare to rebound and remodel its future. So we think it's about the purpose, the respect, the inclusiveness, the mastery, and of course, in healthcare, the efficiency. An action on fundamentals to the prime of the healthcare to the next model through digital was the José Bastos and a doctor there, Frederic, told us that digital is the new normal. We passed from 10 years behind to go online in some platforms. So what are we defining for the new digital aligning digital with the enterprise objectives. We all like talking about the Uberization of the healthcare, to put in our hands the services that most of all asks for the vision of 360 degree. So we must have an approach to information governance. We have to do a right planment of the of our healthcare in Portugal and aligning with Europe, and we have to have scientific borders because nowadays we are very awful in communication, and this new approach to enable trust, to give our patient engagement technologies that will support healthcare resiliency in adapting and responding to business disruption. So we have a last sentence to say that inability to efficiently to assess the data. Data is the new holy grail, if you want, about what we are doing in the working models through actionable insights and prospective workflows. So I hope you are all safe with your families and safety. And a big thank you for in name of our section group to be part of this amazing journey in today's digital. Thank you, Paul.
Thank you so much, João, and your really awesome contribution, and thank you for your moderations, and the same for Pedro and Carina. Thank you all, also Andy, for joining us. I would like not to leave this meeting without sharing with you two premium members that we were lucky to have attracted. José Antonio Silva, one of our premium members, and I'm not sure he was able to join the session today because we had issues with the security on Zoom. But José Antonio Silva is the R&D director of DevScope, is one of our participants, premium participants today with us, and also we have another participant with us, which is something that someone that I really like also to share here and acknowledge, because it's someone that has already took on board a new project that we are starting, and it's Luis Duarte from More Results. I cannot say more at this stage for this moment, but Luis Duarte is the general manager of More Results. I'm not also sure if Luis will have the chance to join us in the debate, but it was really great to have their premium participation in our session. And Pedro, anything else you'd like to add from our conversation before we end this broadcast?
Yes, just a brief statement. Okay, I will be fast. First of all, it was important today to attest the strength of the Portuguese digital health ecosystem, and of course we would like to thank all the participants and speakers who join us. Also, a special thanks to ECHAlliance that has allowed us to connect the Portuguese digital ecosystem to other international ecosystems, and this year started with decisions and good news. So I would like to mention that this year we have COTEC as our innovation partner. COTEC is the main Portuguese business association for the promotion and innovation and business technological cooperation. So they represent 16% of the Portuguese GDP and 80% of private employment. Okay, so this is a very important partnership for Digital Health Portugal. Then we can also announce that we have TIS, so the National Portuguese ICT Cluster, as our cluster alliance. The consultation platform TIS ensures and promotes the interfaces between the academic world, represented by universities and institutes, the business world, represented affiliates, and also through networks, in particular SMEs represented by their associations. So don't forget that we are in the middle of or in the start of a recovery plan in Europe. Okay, so this is all about European funds. We are also in the middle of the Portuguese presidency of the European Union, so this is those are positive vibes. Okay. And finally, in October, of this year, we will have the Global Hybrid Summit in the city of Oporto, not in Monaco, in Godumar, but in Oporto, in the center. So, and we want to bring together the Digital Health Portugal family with national and international speakers, bringing, with the help of ECHAlliance, of course, European ecosystems, as well as those from countries with historical relations with Portugal, like Brazil and India. Okay, so those are those are good news, and we hope that 2021 will be a year of overcoming and success for world health, and of course for all those who promote digital health. Thank you very much.
Absolutely. Thank you so much. And for mentioning this, and also very, very proud to already announce our new website with the background of the city of Oporto. Welcome all who are watching this presentation concerned with healthcare, health, and health data. Health Data Forum will be the venue for you, and hopefully we can all be there together having a toast with Porto wine in one of these beautiful cases in Gaia, which is just the opposite to Oporto. Here in this part, there's the port wine galleries, wineries, and we can do a lot of wine tasting and socializing, hopefully without the pandemic anymore. Is this wishful thinking, my friends?
Let's go for it.
I hope so.
I'll bring it around.
Okay, thank you so much for joining all, and we're going to close the broadcast now. Thank you also to our dear viewers that are following us all this afternoon. Thank you so much, everyone.
Thank you. Bye-bye.
Thank you. Bye. Bye-bye.
Bye-bye.